So my family has grown up in South Dakota. We've lived in South Dakota my whole life, and almost her whole life was in the Midwest as well. She spent about 30 years managing a medical clinic in Chamberlain, South Dakota, and worked in family practice specifically, and was also an x-ray technician and a dental assistant. And when she was 64 years old, we started to notice some odd behavior. She was kind of losing her words, having trouble coming up with words. She was asking questions about navigation, how to find someone's house that she's been to many times. Had some trouble with planning, so coordinating her day, thinking about how long something might take, some of those skills. My sister noticed it first and brought it up, and honestly, I kind of brushed it off and didn't really think much of it. She talked to my dad, and he had also seen similar behavior at home. And so my sister chatted with my mom about it and asked her if she was noticing some of these things, and she said she was. However, my mom is a fiercely independent person and was still working full-time at that time, and very much involved in her hobbies and extracurricular activities, and very much wanted to maintain her independence. And so she kept a lot of the symptoms and things that she was experiencing to herself. And so we had to kind of pry it out of her. Luckily, she was willing to attend an appointment with her trusted clinician, her family practice physician, and they did some initial screenings and identified that there might be some concerns there. Luckily, my sister works at Mayo Clinic and was able to bring her to Rochester for a full assessment, which is generally, in the real world, a very difficult appointment to get. There are wait times that are 4 months long. We were able to do it within a month, and so she went to Mayo, had an MRI, did blood work, and a few other things. She was diagnosed with mild cognitive impairment at the age of 65. And what that means is, short term is MCI, says that, hey, we noticed that there are some cognitive challenges that could include planning, memory, word finding, navigation, a variety of different skills. And they identified that she was in fact having challenges with those and diagnosed that as mild cognitive impairment. And that was at 65, and that was a really tough time for her, and it progressed really quickly. She lived at home and was very, very angry. She had a lot of paranoia. She had trouble remembering to eat and drink regularly, so she passed out a couple times, once in a grocery store, once at home, had to go to the hospital for those. And ultimately, it got to the point where she needed care that my dad couldn't provide at home, and so we assisted her with moving into an assisted living here in Sioux Falls. And then very quickly that transitioned to her living in a secured memory care unit here in Sioux Falls. She probably moved from assisted living to memory care within 2-3 months. And so she stayed in memory care through COVID, so it was sort of a mixed blessing that she was there. I don't know what that would have looked like if she was still living on the river in Yankton with my dad through 2 years of a pandemic. At the end of the pandemic, last October, she passed away following what we believe was a good reflection of her interests. She maintained the entire time that dignity was really important to her. And so we helped her create an advanced care plan that reflected her interests in relation to dignity and care.
So as a caregiver, I'm guessing you cared it. I know your father did. I don't know if you cared for her as much, but what were some of the resources that you used to help you care for your mom?
Yeah. So when she was in Yankton, my dad was physically there in the house with her, supporting her. A lot of the care happened between my sister and I. What I found is that when we talk about caregiving, people often think of the physical aspects of caregiving. But when we're talking about early stages of dementia, more of it is care coordination. I spent a lot of time helping my mom prepare maps for navigation so she could continue to drive independently. We spent a lot of time helping her make memories with her grandkids, coordinate vacations and cruises and trips and things so she could have those experiences before she lost the ability to remember those short-term memories. So a lot of the work, a lot of the caregiving really looked like care management, making appointments, things like that. A little bit later, it started looking like helping my mom make sure that she had the nutrition that she needed. I used my sister as a good resource for both nutrition and medication management. My sister's a pharmacist, and so we looked closely at what that might look like. Many times when we look at Alzheimer's disease specifically, we're also looking at what we call dementia-related behaviors connected to Alzheimer's disease. And those are the symptoms that include like depression symptoms, anger, paranoia. In my mom's case, she also had some hallucinations. And so we sought out guidance from our clinicians about how we could support her in feeling more comfortable. And that included some medication management as well as some ways to provide her with moments of joy. There's a book by a woman named Jolene, her last name is escaping me, but she wrote a book called Creating Moments of Joy, and our family used that book daily to change the way that we interacted with her, the language that we used. We very quickly learned that as a family, the standard was never saying something like, "Remember, Mom, we already talked about this." That didn't happen. We simply repeated the thing again. We simply told the story again, or if she wanted to tell a story multiple times, we listened to it multiple times. And that was a really important part of her finding joy in life, as well as us finding joy in our relationship with her. So we tried to really focus on creating memories. When it became later, and she was in care, when she was in the assisted living home, I was there every day, writing on her whiteboard, making sure that she had reminders about who her neighbors were, what time meals were, a lot of those things. In fact, the amount of energy that I was putting into caregiving with her during that time was one of the reasons that we realized that moving into memory care would make a little bit more sense. She would have less inputs to manage. In the assisted living, she had her own apartment, she had a kitchen, she could cook, she could go grocery shopping, and that was just too much information for her to manage. Moving into a memory care facility allowed her to have a bedroom and a bathroom, and somebody else can manage making meals and can manage going grocery shopping. And it's just a little bit less stress on her to think through those things. And honestly, if we're talking about her goals for care, which is dignity, it doesn't require her to ask for help as much. It doesn't require her to do more word finding and more navigation. And so our family spent a lot of time with that. I will say that I wish I'd reached out to the Alzheimer's Association earlier. Many times we see that folks don't reach out to the Alzheimer's Association early enough in their disease, and they call us when they have an emergency or a crisis or something that they've been stressed over for months. I later learned when we talked about driving with my mom, that was the first time I reached out to the Alzheimer's Association, and they gave me a driving contract that we talked through with my mom. It didn't quite work for my mom, but I hear it works really well for some people. And so the Alzheimer's Association was able to help me walk through what could hospice look like, when might we reach out to palliative care, and based on my mom's goals of care, we were able to create a really respectful plan of care with her that matched her values.
Could you tell me what you were feeling inside during all of this?
My sister and I are both really type A black and white people. And so we are checklist people. I spent a lot of time achieving tasks, and we had to really force ourselves to have deep, good conversations with my mom about her memories. One thing that I'll say that COVID brought is the ability for us to slow down and process some of the feelings that we were having during this time. It allowed us to listen to memories, no matter how changed they were based on my mom's disease. But it forced us to slow down and listen to those stories a little bit. It also forced me to think about how this disease was impacting me. In fact, that's one of the reasons that I changed careers, to be able to continue to support ending this disease.
Could you tell me, maybe this is similar answers too, but could you also tell me maybe the hardest part about having to help your mom through Alzheimer's?
Yeah, a lot of people assume that the hardest part is her forgetting my name or forgetting her grandkids' names, those kinds of details. But really, we found the most difficult thing was dealing with those dementia-related behaviors that I mentioned before. My mom was very angry for a long time, particularly about losing her independence, losing her ability to drive, having to ask for help with things. That was really tough, especially knowing my mom lived a life of adventure. She went on vacations with her girlfriends. She led red hat groups. She did all kinds of things. And watching her lose that month by month, it was really devastating for not only her, but for all of us to watch that. We wanted to give her as much independence as possible, but what we found was that sometimes giving her that independence caused more stress to her. And we slowly had to start taking things out of her life so it wasn't overwhelming. That was really the hard part.
So then you mentioned about your current, so you said you had a career change. When did you, I'm guessing the career change is here, when did you start working here?
Yeah, so I started working at the Alzheimer's Association about 2 years ago. I work in supporting health systems, clinicians with improving early detection and care. And I was doing the same job at another health organization prior to the Alzheimer's Association. And it was just a natural switch to be able to really focus on a disease that I know very intimately. I know also through my experience with my mom that a lot of people don't understand dementia. They think that it's someone who has memory problems. And it's so much more than memory problems. And it does not look like sweet little grandma forgetting, what time it is. It really is far more involved than that. And one of the main things that I wanted to do in my work was make sure that that is well educated to the community.
Okay. Then what does the Alzheimer's Association help with?
Yeah, so our effort is to provide clinical resources to clinicians, to manage the cost of care for people who are experiencing dementia. And I should clarify that the Alzheimer's Association supports the care for all types of dementia. So when we talk about dementia, we're really looking at an umbrella term that covers several different types of diseases that are under the term dementia. Alzheimer's disease is the one with the highest number of people that have that disease. So we're talking about Alzheimer's disease, specifically with my mom, that is what she had, but other people have other disorders. You might have heard of something called Lewy body disease. That's another type of dementia. When we talk about how the Alzheimer's Association supports those people, we're looking at family and caregiver support. That could be support groups, education, community involvement, connecting people. We have really fantastic early stage groups. So people like when my mom first was diagnosed and still was working full time and still was driving herself, other people might not know that she had dementia, and she did a really good job of hiding it. But that's the time when we can really connect people to meaningful work within their community. For example, in Minnesota, there's a really great early stage group that meets to do master gardening with the master gardening group up there. Super creative and really meaningful for those people. In my work specifically, I'm helping clinicians implement plans for early detection. And when what we know about Alzheimer's is that changes can happen in the brain at least 20 years before we start to see symptoms. And so when we're talking to clinicians, we're talking about what does risk reduction look like? What does prevention look like? And how can that look for annual wellness visits for patients? Can we do a cognitive screen so we can get a baseline number in the same way that we use biometrics to measure your blood pressure to define cardiovascular health? So that's a big part of our work. We also do advocacy work, both at the state and the federal level. We're looking at NIH, National Institute of Health funding to help fund researchers who are identifying a variety of different paths for what might be causing and what might prolong this disease. That looks a lot of different ways. And we are also looking at this from a concern and awareness standpoint. How can we get the message out to the community about what dementia is? Why is this important? How does this impact you? And what is this going to look like as our population continues to mature? We know that the number of people that will be over 65 by 2050 is going to grow dramatically. And as age is the highest risk factor for Alzheimer's disease, we know that that will be a similar impact.
So just clarification, is this Alzheimer's Association, is this a nationwide thing or is this just like Midwest kind?
It's a national organization, and then we also fund researchers from around the world. So we have researchers that are funded through our grant program in 6 continents.
Okay.
6 continents?
6 continents. So if you know anybody from Antarctica, that would be great.
Oh man. So, all right. So, anyways, back to I think this will probably be one of my final questions, just to wrap things up. How did your experience with your mom translate to this kind of work, helping other people deal with the problems?
Yeah. So I've worked in healthcare for 20 years now, in a variety of different areas. Really, all of it has led to my work in quality improvement. That looks like connecting with hospitals, clinicians to improve care, to manage the cost of care, reduce clinician burden. All of those are efforts that I've been doing in healthcare for years. When my mom was diagnosed with Alzheimer's, I grew this keen awareness that the public doesn't have a clear understanding about what dementia is and how much of a strong impact dementia will have on our community, not only now, but in the next 20 years as our community or as our population continues to grow. That was really the moment that I realized people need to know about this. We also have a strong heart-brain connection. And so when we look at people who are having cardiovascular conditions, we know that that's also going to impact their risk for dementia. And so how can we pair that work to ensure that people have a good understanding of their risk profile as it relates to how they're going to function as an older adult? And then how can we give quality of life to people in later years? I think sometimes our society places a very strong focus on quantitative years rather than qualitative years. And I'm going to make it my personal goal to help people live their lives comfortably in the years that they have. When we talk about my mom's care, she really wanted to be able to do independent things. We would spend time just going out for coffee and be present in that moment. And so many times people are trying to extend their life, go to work more hours, do the hustle. And I think that there's value in slowing down and really being with the people that you love and hearing their stories.
All right, thank you. Let me just check to see. I got one more thing. Okay, yeah, so my final question for you is, so what do people who have loved ones struggling with Alzheimer's need to know about, like, I guess, the care and, like, what to expect?
Yeah, so we get this question a lot when people are wondering, what's something I need to know in these early stages? My loved one is having some word finding challenges, or I noticed that My dad missed that stop sign the other day. Some of those like little early signs. We have on the Alzheimer's Association website some initial steps that folks can follow, questions you can ask yourself. We call it the 10 warning signs. And those 10 warning signs are a good step forward on identifying if that's dementia or something that needs to be assessed, or if that's normal cognitive age-related decline, which happens. We all forget where we parked the car. We all can't find our keys sometimes. But the key is to really ask those questions about, can you retrace your steps back? Did you come in from the garage and you set your keys down here? You'd go back to that spot. Someone with dementia might not necessarily know to do that. And so watching your loved one, seeing if that's something that they're able to do. Perhaps there are other conditions that they have in their life. Identifying if they have what we call comorbidities, other health-related conditions that might be impacting their behavior. Maybe they're having trouble sleeping. Maybe they've just changed medications. Maybe they have a vitamin deficiency. Having some of those labs done with a trusted clinician is a good step forward. It's my opinion, I mentioned earlier that it took us a really long time to reach out to the Alzheimer's Association. And I think if I had done that earlier in the process, I would have known what questions to ask at the clinician's office. When we go to see the physician for a full assessment, I would have known what questions to ask and what specifically they were looking for. When he says hippocampus, what part of the brain is that? Why does that matter? Some of those things so we can be more prepared. I would have also suggested that people can join a support group. I found a lot of value in being around other people who were also experiencing dementia, whether that was a caregiver or someone living with the disease themselves. It's really good to have that perspective about what's important to people. And then ultimately, it's my opinion that all people, regardless of whether they have a terminal condition or not, we should all be writing advanced care plans, meaning we should be preparing living wills. We should be identifying how our final months and years should look like in our lives, what might happen if we have the need for additional medical care, and how we want that to look and where we want that to happen. I think many times we don't make those decisions until we have to, and making any decision under duress is not the best decision. So a lot of opportunities to learn more about advanced care planning in our society.